Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
Heart transplant. It's a surgery to remove a person's diseased heart and replace it with a healthy heart from a deceased donor. Now, that's an operation you don't want to have unless you really need it. Most heart transplants are done on patients who have end-stage heart failure. Now, end-stage means the condition is so severe that all the treatments other than heart transplant have failed.
Survival rates for people receiving heart transplants have improved, especially in the first year after the transplant. According to the National Institutes of Health, almost 90% of patients survive the first year after transplant surgery, and 75% survive 5 years. Here to talk about heart transplant at Mayo Clinic is cardiovascular surgeon Dr. Richard Daly. Welcome to the program, Dr. Daly.
Well, thank you very much for having me, Tom and Tracy. Appreciate being here.
Dr. Daly, nice to see you. It's Richard Daly, but you go by Rocky. Where'd you get that nickname? Why do your friends call you Rocky?
That's been my name my whole life. When I went to kindergarten, they asked for Richard, and nobody put their hands up. I was looking around for who that would be, so as long as I remember.
So your parents started calling you Rocky from day one?
I think I looked beat up from birth, and that was
I have to say, if you were my heart transplant surgeon, I would feel pretty good about saying Rocky is my surgeon. That's
Rocky
a good deal.
Yeah, the Rock. So you've been doing this a long time. How many heart transplants do you think you've done, or do you keep count?
We know how many we've done at Mayo Clinic, and I've been involved with the majority of them. We've done a little over 600 now. And the year I was training, we did about 150 that year, and I was involved with most of them. So I haven't been involved with all of these, but a good portion of those.
It's become less common? You said you did 150 when
you're
toll training.
Yes. Well, no, and I trained in London for a year, and they have a little different system where they did at the time. Not as many centers, and few centers doing a lot. But at Mayo here now, we're up around 600.
How many do you do each year?
We do about 30 per year, and that puts us in a little above average around the country. There are 3 heart transplant centers in our state, and we share donors, so we have a limited access to donors, and that's what limits it. The number of transplants per year in our country has been pretty fixed over the last few years, around 2,500 a year.
People still haven't gotten the message that being an organ donor is important.
Well, I hope more people do, and but I think that's the big message to get out to the public, and the reason I appreciate being here.
So how many people on the waiting list right now?
We have about 100 on our waiting list here.
And how many around? Sorry.
I was just going to say, and are they hanging around campus here just waiting, or where are they?
No, some are sick enough that they're in the hospital and waiting, and some are around town because they're higher up on the waiting list, but most of them can be at home.
And I think there's, some 3,000 around the country who are waiting for a heart transplant. Does that sound about right?
That's about right.
So what do you do in between? I'm sure that some patients die waiting for a heart transplant, but you have other ways to keep these patients alive, don't you, even if their heart completely fails?
Right. So the first step, of course, is medications. And the medications today for heart failure are very good. And we end up taking some patients off the list once they get optimized on heart failure medications and they get better. In other situations, when they're deteriorating, then the next step is mechanical support. The heart is a pump. So theoretically, you just need a pump to pump the blood. And that's been a challenge to get something that will do well in the bloodstream. But we have good pumps now, and we're able to support a lot of people to transplantation, and many people live on these pumps for even a number of years. The left ventricular assist device is the primary device that we use, and the current devices are continuous flow devices that are very durable now.
But they have to carry it around with them, right? I mean,
oh yeah. The pump is implanted, and then there's a little cable that comes out through the skin that goes to batteries and to a controller. And those things are about the size of a little older-fashioned phone to carry around.
But the pump is actually in the body, inside the body.
Yes.
So it's taking the place of the heart. It's a little pump inside the body.
It assists the heart. It's like a little propeller that's pumping the blood. It takes the blood out of the heart and out of the left ventricle and puts it around to the aorta. And it can pump all the blood the body needs, But we don't remove the heart with these devices. We leave the heart, and the right ventricle is still pumping.
What about a multi-organ transplant? The last person that I know who had a heart transplant also had lung transplant at the same time.
So we do a number of multi-organ transplants at Mayo, and the reason we can be sort of have some expertise at that here is because of the collaboration with our colleagues that's so available, and liver and kidney and lung surgery. So yes, we do a number of combined organ transplants. We've done more combined heart and liver transplants than others in the world, although that's still only about a little over 40 that we've done in our experience. And combined heart and lung transplants have become rare in this country, but we can do a couple of a year if we have patients that are sick enough for that.
What has made heart transplant more successful today than it was a decade or two ago?
Well, it's been, in the last decade, it's been incremental changes. A couple of decades back, the medications really changed dramatically. There was a kind of quantum improvement with cyclosporin, and now we use tacrolimus. But in the last decade, there's been gradual improvements in care, and better understanding of immunosuppression, better testing for antibodies, and better care with infectious diseases, which is a great help from our infectious disease colleagues.
So your ability to prevent the body from rejecting the organ is better than it used to be.
It is, and our ability to monitor for it has gotten better.
So you do, 1.5 of these a month or so. How many could you do? How many people are out there? You said you've got 100 sitting around here, but if you had as many hearts available as you needed, how many would you be doing a year?
Yeah, that's a great question, because if obviously the waiting list is a little bit limited, everybody realizing that we're only going to do so many. So there's a certain selection that occurs. And there was an estimate by the Institute of Medicine, maybe 2 decades ago, that we would do as many as 50,000 transplants in this country per year if we had the hearts. That was 2 decades ago. Hard to know exactly what that means, but clearly we would do
a lot more,
2 or 3 times at least more than what we're doing now.
And then once you put the new heart in the recipient, do you have to shock it to get it going usually, or does it sort of start beating spontaneously sometimes?
Each little muscle beats spontaneously once you give it blood and get it going, and the shock just resets all the muscles so that they contract simultaneously. And often they'll start contracting simultaneously, and occasionally we shock it so that they reset and beat together.
And
boom,
finally,
it's beating.
And finally, what research is being done? What is in the future?
Well, more advancement in the mechanical assist devices, better immunosuppression, which we've been working on here, and perhaps other sources of hearts, such as pig hearts, xenotransplantation, and those are probably the main things right now. It's of course, yep.
Dr. Rocky Daly, heart transplant surgeon, you do great work, and thanks so much for being with us.
Oh, thanks for having me here. Thanks, and I hope everybody remembers to consider donating.
And that's our program for this week.